I'm Dr. Maria Boscia with the Center for Sexual Health and Education. Today's topic is compulsive sexual behavior or sexual addiction, although these are controversial labels for a problem that many people struggle with. A person who has this can't control their sexual desire and behavior. Whatever you want to do about a label, however, a person who struggles with this often feels like they can't control themselves. They can't manage their sex drive. They can't stop themselves from acting out in these sexual behaviors. Lots of times it affects the relationships in unfortunate ways. It can interfere with work. It can cause a person to engage in risky behaviors that put their health and life at risk. But somehow they can't seem to stop, and they feel a lot of guilt and often a lot of anguish about this. This used to be a problem that was predominantly identified in men, but since the rise of the internet, it's been an increasing problem among women. This is probably because with the internet, it's very anonymous, it's very private, and it's very accessible. Unfortunately, when a person gets trapped in a compulsive behavior like this, it's often progressive. That is, the person needs more and more of whatever they're getting stimulated with in order to get the same adrenaline rush. And so things get more and more risky in order to get that high. Often there's little satisfaction that goes along with this. There's lots of anxiety often and difficulties with intimacy and relationships. Treatment of compulsive sexual behavior often has to address a number of different factors, like, for example, the impulsivity itself or the anxiety associated with relationships. Sometimes we have to also look at a person's history, because sometimes people who are trapped in compulsive sexuality have sexual traumas in their past, and those traumas need to be addressed and worked through for a person to get beyond them so that they are free of the compulsion. Sometimes the compulsive sexual behavior is part of a larger psychiatric problem, like obsessive-compulsive disorder. In that case, there needs to be psychiatric intervention, probably with medication. In any case, we at the Center for Sexual Health and Education have experience with this disorder, and if you're interested in learning more about it, please feel free to contact us. You can visit our website at www.bestsexualadvice.com.